The Cuban Center of Neuroscience has a new building. This facility is run by these twin brothers, Pedro and Michel Valdez, considered genius.
So, Mitchell, from being a scientist to like a contractor, right?
Right.
Why? Big change, right?
It's a very big change, but it's the only way we can fulfill our dream of having a new and modern center for brain research in Cuba. The Cuban Center for Neuroscience originated within the National Research Center of Cuba. This is the very first organization created in Cuba for scientific research, and it served as like a nursery within which other centers started to grow, and then later on was separated and followed their independent paths. We began as a laboratory inside the Cuban Neuroscience Center, but our dream was always to have our independent building, have more complete research facilities, and to have more advanced equipment. So now we've been working for several years, and we're going to finish this year in October with the inauguration of our new building.
Brothers, twins, who came up with the idea of investigating the brain?
He did. I was doing research in biochemistry, and he became connected to a group of scientists that were working in Cuba, headed by Dr. Talia Harmony. This is a Mexican scientist that came to Cuba to teach. And he called me. He said he called me one day. He said we're working in this field, and I joined him. But this was what year?
This was 1969. 1969, and you started about 3 months after I did.
Yeah.
How do you two get along?
Oh, fantastically.
Really?
Oh.
In all circumstances?
If you separate the daily discussions, right, we get along very well. But it's very interesting that our center, I think, now Cuba's helping people all over the world with doctors. But you have to remember that in the early years of the revolution, we didn't have enough doctors. And scientists came from all over South America to help Cuba build up her medical school. So in a certain sense, help that now Cuba is giving to people, countries like Venezuela, Brazil, Nicaragua, other countries, is simply, we're giving back something we received from all South America. But not only for South America. Our lab from the 60s had a lot of help from American scientists, that despite that the government discouraged this exchange, scientists always feel free to help. And there's one scientist, Dr. Roy John from New York University, that was developing the use of computers for analyzing the electrical activity of the brain. And his influence was very important for us.
I would like to see more of the
Sure.
of the
Let's
work.
go.
Okay.
Please come in.
So we had to left Mitchell behind.
Well, you know, as you said, he's a contractor. He's now supervising the finishing touches on our magnetic resonance imaging system.
And what do we have here?
Okay, this is an illustration of the new facilities that the Cuban Neuroscience Center will have. This, in fact, is a production facility with three-dimensional printing. The idea,
Like this,
for example,
example.
this concrete example is that we're producing hearing aids which are individualized to each child. So the best way to solve hearing problems is with hearing aids. The majority benefit from it. But if it's uncomfortable, the children won't use it. What we do here is that we obtain an impression of a child's ear. You see here, they're retouching it with the computer. Anything that's in the computer can be reproduced on a 3D printer. And here we already see the different types of hearing aids that can then be put into the child's ear without any discomfort.
For free?
This is something that's provided by the Cuban health system for free. And in fact, you can see here the productivity of this is hundreds a day, when if you do it by hand, you could produce maybe 1 or 2 a day. So not only do you have increased productivity, but increased health coverage. So this is one example of the use of technology to solve a primary health problem.
Interesting. Interesting, Peter. Very interesting. I would like to know more about this center.
Okay.
Let's go.
They were born in Chicago, United States, but came to Cuba in 1961 and studied medicine. We talked with Dr. Pedro Valdez, who also studied math. He's the Vice Director of Research and known for working in the first Cuban computer back in the 60s.
Please come in. Thank you. So this is not your office, right? You're moving.
Yes, this is a provisional office. On the 17th of October, we shall inaugurate our new facilities. We've existed since 1969, but now we are inaugurating a new building with more possibilities.
So you have, when I read, Doctor, about this center and about your work, it was interesting to know that early diagnosis of psychiatrists and neurological diseases are like the main goal. What are the principal results that you have in this field?
Okay, we started our work in the late 60s, to be exact, in 1969. In fact, with the use of a Cuban-designed microcomputer. It's a project we participated in.
The first one?
It was the first one. And the objective from that moment was to try to combine the most advanced basic research in order to solve health problems. One of the first targets where we demonstrated that this was feasible was when we developed a system for the early detection of hearing loss in newborns. In fact, in the early 80s, we started a program, a national program for the early detection of hearing problems, which has already been in place for all these years with demonstrated effect. If you detect a neurological or psychiatric or neurodevelopmental problem, very early on, you're able to act. We have hard evidence that the early detection of hearing loss can lead to an improvement of more than 10 points in the IQ scale or 5 years in the development of language. We have other examples. We've been looking at learning disability. We've been looking at other neurodevelopmental disorders. But our main focus will be now in the next years also the early detection of cognitive impairment associated to the dementias.
Yes, because Cuba has a big problem because of the aging of people. Not a lot of newborns.
Well, I'd say the world has a big problem. In fact, there was a recent meeting of the G8 just on dementia. But yes, you're right, it's correct. Cuba, in the Americas, due to its health system, not so many children being born, we have a very, very aged population. In fact, the estimates tell us that in a couple of years we'll have, for a population of 11 million, we'll have about 300,000 people with dementia. Probably 300,000 more that will have a severe cognitive impairment. Without counting that any family that has a person with one of these cognitive problems also has other problems they have to take care of and whatever. It is an enormous social burden, both economically and in terms of loss of years. This has been quantified by the World Health Organization, the World Bank. They have measures such as disability adjusted life years. This is the number of useful years of life lost due to a disability. And it turns out that these dementia, the psychiatric diseases, they're the major burden of disease. Sometimes there's not this perception. Sometimes when you ask someone, especially from our region, from Latin America, what are the major health problems, they think in terms of how people die. And then they're thinking of heart disease, cancer, maybe stroke, which is a brain disorder. But when you ask not only how people die, but how they live, with what quality of life, then what emerges as one of the main contributors is everything that has to do with the brain. And this is something that's well recognized in developed countries. In fact, it explains the reason why at this moment there's so many major projects to study brain function that have been launched by the European Union, by the US. China has several. In fact, I'm sadly disappointed that Latin America doesn't have a major brain project, because our people are getting just as old and have the same amount of diseases as in other countries.
I have a question,
Yeah,
like
please.
cultural, to know what's the main mystery that you, the scientists, still can't answer about the brain?
Okay, imagine the brain is a terribly complicated computer for which we don't even have the full wiring diagrams. We don't know the programs, and what we know are some behaviors. So we still don't know exactly, though we know a lot. The growth of knowledge on the brain has been exponential. In fact, there's much more knowledge now about facts about pieces of the brain than we can really deal with comfortably. We had a discussion. We have an organization called the Organization for Human Brain Mapping, and I've been the program chair for that. We just finished organizing a congress in Hamburg. But last year, the director of the National Institute of Mental Health of the US went to discuss with us their brain project. And one of the things that we pointed out in the discussion in the General Assembly was that the scheme that they have, the idea of these projects is to produce a lot of basic knowledge. Have that basic knowledge floating around, have companies take that basic knowledge and turn it into devices or pharmaceuticals. And then that will somehow trickle down to the general population. I don't think that's going to work. And I don't think it's
That's
going to
work for the people that has the money to pay for
Exactly,
it.
exactly. Let me give you an example. Recently, in the meeting of the G8, where it was a summit only on dementia, because dementia is a crippling economic problem, they gave an estimate that to develop a drug, which they hope to have maybe in 5 years, that at least will, let's say, slow down the appearance of dementia, it'll cost 17 billion euros. Now, I wonder what price this drug will have for people living in Africa or in Latin America. So that's one of the reasons. I mean, we saw it with the development of vaccines in Cuba. The big companies won't touch vaccines with a 1,000-foot pole. They're not interested. It doesn't make money for them. So if there are treatments that are possible to slow down dementia or whatever, I think it is really our task in Latin America to do this research and adapt it to our circumstances.
So it's a kind of freedom to investigate this kind of thing.
Well, it's a freedom we have to win, because what's really happening in, and that was early on identified by the people who created our lab, is that since the model for developing countries is to send our young students outside of the country to train in the best places, which we have to do, and we have to have excellent relations with the best labs in the world. But then they come back, and the problems they're addressing and the style of things they're addressing is not our problems. So we have to obtain our freedom. Also, I have to say that I do not see a concerted effort by the countries of our region, either in research or in coordinating the introduction of this research into society. The end result is that we're doing a lot of research in our countries, but it's benefiting the first world, not our own. This requires a particular combination of bridging the results of research and introducing them into public health systems or educational systems. And this is something that I think is of the essence for us, for our own economic development and for our own independence.
You've said that, and it's no secret that Cuba has one of the most effective public health system in the world, and our statistics are the main proof of that. Even though we've been suffering from a blockade for more than 50 years, even though we've been living in an economic crisis since the 90s, and right now we are living what is called like an update of the Cuban economy, which in a way means that we are like making changes in the economy in order to finally get some kind of developed. Do you think in this structure that we live in now, science has been delayed in a way?
I think it's stagnated, frankly. I think that other countries in the region, such as Chile or Brazil, have managed to forge forward. And I think that there's an essential mistake, that is that science is something you indulge in when you have your economic problems solved. That's not true. Science is part of the solution of our problems. And money may be part of the problem, but organizational problems that I think have not been accelerated sufficiently. We have a challenge. We have a challenge of economic difficulties. We have a challenge of a changing world. And I think that we have to do much harder in preserving Cuban science, which is at a very high level. And this is something that has to be a priority, really.
There's, even though what you're saying, it's like difficult to believe that a country like Cuba, which is a developing country, small country, and in these economic conditions, have been able to participate in programs like the mapping of the brain. Do you think that we will be able to keep up with the development of this kind of science around the world?
Certainly. I mean, I'm very optimistic about this, not because I believe that something magical will happen. It's because we're determined to keep up. We have to play a particular role. We cannot compete in terms of huge systems and millions of dollars of money. We can compete with ingenuity, with bright ideas, and also we can be the bridge between the high-level science, and this is seen like this by many leaders. In fact, when we inaugurate our building, we're going to have here an international workshop of the leaders of the brain mapping community. And they're coming here because we're trying to find a bridge between high-level research and the application in all countries. And we think Latin America has a specific role to play. It's not surprising that the brain mapping organization in the world, its only first chapter, which was just approved, is a Latin American chapter. This is an acknowledgement of two things. One, of the possibilities of the region, and second, of the role that Cuba has played in introducing advanced scientific results into the public health system.
We have a complicated relationship with the United States. You know that very well. You were born there, as a matter of fact. How do you think the blockade, if the blockade is removed in the future, how do you think this would change the scenario of the Cuban science?
Well, if the blockade is removed, I think that we could cooperate with the states. I mean, I've told congressmen from the US that they, and of course they're from the Black Caucus and they agree with me, that instead of this hostility, imagine the experience of Cuba in public health combined with the technological advances of the US for other countries, not even only for Cuba. We just had the visit early this year. I helped organize a meeting between the ASSS, the ones that publish science, and the Cuban Academy of Sciences, and which there was an editorial in Science, by the way, I can give you later. And for the third time, a Nobel Prize winner came. But his interest is precisely in that, in cooperation. The experience of Cuba in public health, its role worldwide, and merging it with technological advances. We've always had relations with the US. It has been the government of the US that has either denied us visas or...
To yourself even?
Yes.
But you changed, you solved that.
Yeah.
How did you do it?
Well, I'm an American citizen, so I got out my US passport. But second, they had these restrictions which have been lifted somewhat about scientists coming here. And third, the blockade of even innocuous equipment. I tried 12 years ago to get MRI system, an advanced MRI system from UCLA here. And they even asked us at one point to prove that we were not going to use that device to torture people. We have half our MRI systems that cannot work because Philips has been forced to stop maintenance on them. And this is well documented.
Consequences of the blockade.
These are all direct consequences of the blockade. We're going to have a new MRI system that was donated by the University of Maastricht in the Netherlands. It's already in place. And I was looking for it's like a toy MRI system so that children won't be afraid. I asked for a quote in Canada, but since the company has US stock, they cannot sell us a system to help children. So
a toy.
It's a toy MRI. It's a toy MRI so that children get used to the MRI before putting them into the real one. And just yesterday, they said that they couldn't deal with us in this sense. So I've been blocked and many times by this absurd policy that only damages the Cuban people, I have to tell you. It really only damages the Cuban people. When we had an epidemic of optic neuritis here, I was in Canada at McGill. And I received enormous help from McGill for getting information here. I called the University of Chicago to ask a friend to come and help us. He was an ophthalmologist. He was called a day later by someone who identified himself as from some government identity, that there was an alleged disease in Cuba, and they just wanted to warn him that it might be used politically by Cuba. So later that was solved because we work with the CDC, but there are people in the administrations that make it their business to try to keep severing possible ties. Fortunately, American scientists are pretty independent, and we've been able to have a lot of collaboration. If the blockade is lifted, if these absurd sanctions are eliminated, then I'm sure that the research will flourish. In other words, the head of MRI of the National Institute of Mental Health just wrote to me, considering the meeting we're organizing. He says, I believe Cuba is the bridge in science for the US to Latin America.
Interesting.
And this is what we're going to discuss. We're going to discuss how to increase the relationship of advanced scientific research with the different countries in our area. And we think that's going to be a model for the developing world.
Cuba is well known around the world because our doctors go to a lot of countries to help. It's one of the main incomes that we have. The services, medical services around the world. Even good doctors, well prepared, but also with the disposition of going to complicated places like Brazil or Sierra Leone, for example, right now with the Ebola disease and all that. But there's, I think, when people or media talks about the doctors and how Cuba works in those conditions, they tend to forget one thing which is essential to this kind of labor and has to do with the know-how, the science, the methodology that these doctors take there. So things that are created in this kind of centers.
I absolutely agree. A good example is the hearing loss we were talking about. We've helped the government of Ecuador to start screening. Nearly 500,000 kids have been screened in the past few years. This is what I'm referring to, that I think that the Latin American governments, because the solution of health problems does not pass through fundamentally through high-level hospitals, it passes through public health. And Cuba has specialized in its scientific and technological development in developing technologies to solve problems of screening, for example. It's much better to screen and to slow down the initiation of a disease than to later have the consequence down the road and not solve it. I think that we need a concerted effort so that the experiences of Cuba can be spread out as well as integrated with other experiences in other countries.
There's a good moment for that. The idea that in Latin America we're living process is political process is very interesting because resources and money are being distributed in a different way, more in a more justice way, creating more equality, and this scenario in this moment is good. But in this sense, you've said in a previous interview, science like a solution to immediate problems, not like an abstract thing, but like a solution to everyday problem with health problems, for example, and how people live. That's interesting too. In this sense, what Cuba has to teach to other countries?
Okay, I think that the unique experience that we've managed is precisely how to maintain very high level of research, but at the same time consider what the end result of those researches can be. This is the difficult problem. We usually have, even in the first world, the idea that the scientist lives in an ivory tower, he does basic research, the best thing he can do in the world is publish in a high-ranking journal, which is true, that's good, because high-ranking journals is the judgment of our peers about the quality of our research. And that is necessary. But that's not enough. It is not enough. I see some countries that are trying to imitate blindly the US when the US has recognized that they have a problem in biomedical research. And I can give you the articles. But some countries want to imitate the US model. I think that we have to take the best of the US model, which I admire many American scientists, but we have to combine it with our own problems. We have to require from our research institutes this, and this is something that has to be done with an integration of different organizations. That's the difficult part. Getting people to work together is extraordinarily difficult. That's something that Cuba learned. I have to say that we learned it when the Biological Front was created, when Comrade Fidel put the Ministry of Health together to work with the Scientific Pole, and then we worked with the Ministry of Education, and we found that pooling efforts was much better than each working on its own side. This is something that is the other element. It's the integration of science into social development.
I have a personal question, Doctor. You told me that the main mystery around the brain is the fact that we don't know enough about how it works. But everything we see, everything we use every day, what I'm talking to you and what you've just explained is the product of our brain. Mm-hmm. Is that why you keep working with this obsession with the brain?
Well, I mean, it's part of the question. It's undoubtedly, I think that understanding the mind, emotions, is the most challenging problem that humans have as learning about the world.
It's not like an anxiety for you.
Well,
constantly.
No. Let's say it's a motivation. There's the other part is that since it's so important, a lot of human suffering. Every time I learn that somebody has become depressed and committed suicide, or that somebody has a psychiatric illness and feels bad, or that a child has left school because he has learning problems, or that somebody, it was too late and trying to recover his hearing, then I feel that we're failing. Actually, if there's something about the horrors of the modern world, where super developed countries are spending so much money in bombing other countries, is that just a fraction of that money spent on trying to solve some of the problems of human suffering, and especially those regarding brain disorders, I think it would benefit humanity a lot, really.
Thank you very much, Professor.
Okay.
It's been a real pleasure to talk to you. I thank you for your brain.
I thank evolution for my brain.
That's a scientist answer. Thank you very much. Thank you.